COVID, and I'm joined by a number of medical professionals as well as a small business owner and Pastor Jerry Bishop as well. So we're here at the Hispanic Center in West Michigan and Grand Rapids today to talk about a familiar foe, and that is COVID-19. Our state and frankly many states are stretched thin once again, and that's putting it lightly. We know that we're seeing familiar scenes play out all across Michigan. Long lines at testing sites, rising case numbers, nurses and doctors and respiratory therapists who are pushed to the brink. They have been breaking their backs for almost 2 years to take care of people, and they're still being inundated with COVID patients. And we know largely it's unvaccinated COVID patients, and that's why today we wanted to acknowledge we are in for another tough 4 to 6 weeks is what all the experts are projecting, with the Omicron variant spreading rapidly across the country. The difference between the Omicron surge and previous waves of COVID-19 are that we now have tools at our disposal, and we've learned a lot more about this virus. We know how this virus spreads. We know how to protect ourselves. We can take actions right now to be safer. So we want to talk about those actions, and we want to ask everyone to do their part. So let's walk through the steps that each of us can take to protect ourselves and protect our families from COVID-19 and both the Delta and the Omicron variants. Now, first, I think it's important to recognize what our goals are. Our goals are simple. Keep Michiganders safe by helping people get vaccinated and get boosted. It's the best way to stay safe against Omicron. Protect our healthcare workers and our hospital systems from becoming overwhelmed. Yes, they are overwhelmed. Let's keep them from getting more stressed under this moment. And let's ensure that our third goal, let's ensure that our kids can stay in school and our businesses can stay open. Now, there are 4 groups of Michiganders I want to address today. 1, Michiganders who have already received their booster. 2, Michiganders who are vaccinated but not yet boosted. 3, parents who have kids in our schools. And 4, those Michiganders who still have not yet been vaccinated. First, to my fellow Michiganders who've already been boosted, thank you. Thank you for taking action to keep yourself, your family, and your community safe, and to help our economy recover. I'm proud to have gotten my booster and that everyone in my family has gotten their booster. Over 35% of those with 2 vaccines have already been boosted, and that's fantastic. It includes nearly 2 in 3 seniors who've been boosted. To you, you're well protected against both the Delta variant, and preliminary data suggests that you are well protected against the Omicron variant. You should still take precautions. Stay home when you are sick. Mask up in indoor settings and high transmission areas, and get tested if you're not feeling well. You probably won't end up in the hospital, but let's make sure you don't accidentally spread the virus to others if you are carrying it. You have done the right thing, and you have taken action to protect yourself and your loved ones and your fellow Michiganders, so thank you. I'm hopeful that together we can help 1 million more eligible Michiganders, including 95% of eligible nursing home residents, get their boosters by the end of January 2022. So I urge you to speak to your friends and family and urge them to get their boosters or get vaccinated if they haven't yet. Second, I want to talk to the Michiganders who've been vaccinated but who have not yet gotten their booster shot. Data shows that you are protected against COVID-19, but not as well protected against the Delta or Omicron variants until you get that booster. So simply put, 2 doses is an important thing that you've done, but the booster is the best way to stay safe. What we know is that the booster offers greater protection against both infection and severe illness caused by variants. So I urge you to make your appointment as soon as you're eligible, meaning 6 months past that second shot of Pfizer or Moderna, or 2 months past the J&J vaccine if that's what you got. Get that booster. We have a robust vaccine and booster distribution infrastructure in place. There are thousands of places you can go all across Michigan to get that booster. A pharmacy, a retail store, medical facilities. It is free and it is effective. So visit vaccines.gov to find the site near you to make your appointment. You've already taken action to protect yourself by getting 2 doses of the vaccine. Please get your booster. 15 minutes of your day can help keep you out of the hospital and keep you safe. We have a narrow window. I mean, we're talking days here. So get your booster before Omicron is everywhere. We see it moving fast, so please act fast as well. Third, I want to talk to parents. I think we all want the same things, right? It's to get our kids and keep our kids in school and to keep them safe. For them to be safe and to continue learning, we're encouraging parents to get your questions answered by your pediatrician or a trusted medical professional that you know. These vaccines can ensure that our kids stay in school and stay safe. Every Michigander 5 years old and up, they are now eligible for these vaccines. And so we urge parents to get their kids vaccinated. And finally, to our fellow Michiganders who've yet to be vaccinated, I urge you to consider moving forward now. We all see the stories playing out of people who've not been vaccinated, who desperately ask to be vaccinated while they're suffering from the impact of COVID, while they're getting breathing treatments, while they're fighting for their lives, and it's too late at that point. If you're unvaccinated, now is a great time to get vaccinated. More than 6.2 million of your fellow Michiganders have gotten the vaccine. 240 million of your fellow Americans have been vaccinated. They greatly reduce the risk of getting sick and vastly reduce your risk of being hospitalized and have saved millions of lives. So, please, now is the time. From January 15th to December 3rd of this year, unvaccinated or not yet fully vaccinated Michiganders made up 85% of the COVID cases, 88% of our hospitalizations, and 85.5% of deaths from COVID. Now, I want to be clear, if you're vaccinated, you can still get COVID, but you will stay out of the hospital. You will be able to survive a COVID infection. That's why vaccines are so important. It doesn't mean you won't be exposed to COVID. It means you'll survive. It means you'll stay out of the hospital. Have a greater likelihood of both of those. So, please, right now, take action. We all want this to be behind us, right? Since March of 2020, we have been facing and fighting this virus. And it feels like we take 2 steps forward, 1 step back. And every one of us is tired of this, I can tell you. We've sent over 2.6 million tests to schools, over 912,000 to long-term care facilities, 550,000 to the Department of Corrections. We started the Michigan Backpack Over-the-Counter program, which has distributed 120,000 at-home tests. We've delivered $275 million to local public health departments to fight COVID and coordinated 3,613 mobile vaccine events. 63% of Michiganders have gotten at least 1 shot. More than 56% are fully vaccinated. Over 2.1 million Michiganders, including 64% of eligible seniors, have gotten their booster. There is hope on the horizon. We're hopeful that the FDA can move quickly to authorize the Pfizer pill and the Lilly therapeutics, which are additional tools. We're making progress, but progress depends on all of us doing our part. Right now, that means getting vaccinated and getting boosted. The longer this virus lasts, the more it spreads and the more it mutates. The more it mutates, the more transmissible and possibly deadly. So, let's all do our part. I wish everyone a happy holiday, a Merry Christmas if you celebrate, a wonderful New Year ahead. Let's all do our part to make sure that that's the case for all. Now, I want to hand it over to Director Elizabeth Hertel of the Michigan Department of Health and Human Services. Thank you.
Thank you, Governor Whitmer. I often talk about my optimism when it comes to the road ahead in our fight against COVID-19. And it is still my hope that we will get to a point where COVID-19 is behind us, or at least a minor concern in our daily lives. However, we aren't there yet, and today we remain at a critical point in the pandemic. Well, vaccination is a choice being made at the individual level. When it comes to vaccine decisions and a highly transmissible, potentially deadly virus, one person's decision has the potential to directly impact everyone around them, including and especially family members, loved ones with underlying conditions, and kids who are too young to receive the COVID-19 vaccine. Earlier this year, people across our state helped to drive down COVID numbers, but now our local hospitals are struggling again to handle their usual load of non-COVID patients, plus COVID-positive patients, the vast majority of whom are unvaccinated or only partially vaccinated. This surge of severe COVID-19 visits and longer hospitalizations is pushing our system and our healthcare workers to the brink. It not only has the potential to impact your access to care if you remain unvaccinated and need hospitalization, but it also jeopardizes the ability of you or your family who might need care for other common conditions or in emergencies to access that care, and that should be everyone's concern. If you need emergency care, you should seek it. However, to illustrate the severity of the situation, emergency room wait times have increased dramatically in some parts of the state, and some of our hospitals have been forced to close their emergency departments for extended periods of time. As the more transmissible Omicron variant continues to spread, now is the time for everyone to make sure that you have plans for the holidays to keep you and your family safe into the new year, and make sure you have access to care if you need it. Here's why. Our state positivity rate has decreased, but remains relatively high at 16.2%, which reflects our high transmission levels. Cases are at 477 per million and have been rising and falling over and over, but remain at an elevated level. This is a number we expect to rise and rise very rapidly as Omicron variant continues to spread very rapidly. The data thus far indicates it is likely that it is significantly more transmissible than other strains of COVID, including the Delta variant, and breakthrough cases are possible. 20.8% of our inpatient hospital beds are occupied by individuals with COVID, and this number has been increasing for 22 weeks. The mortality rate is increasing, and from December 3rd to December 9th, there were 756 COVID deaths. That's over 100 people every day in 1 week who won't be here to celebrate the holidays or ring in the new year. And there could be hundreds or thousands more who won't be at our tables next year unless we make the choice to double down on our precautions this week and in the coming weeks. None of us can predict whether we will get mild or severe symptoms or if we find ourselves facing long COVID symptoms. Even otherwise healthy and young people can get sick or end up needing care. So it is important that everyone use all of the proven prevention strategies that we have at our disposal. Over the past month, 30 to 39-year-olds were experiencing the highest case rate, and there were increases in hospital admissions among most age groups under the age of 50. The best approach to stay healthy, help our friends, family, neighbors, and others who work in healthcare, and make sure that our emergency rooms are open when we need them, is to take steps to prevent COVID-19 or getting loved ones sick in the first place. So in addition to supporting vaccines and very strongly recommending masks, the Michigan Department of Health and Human Services has been working with our local, state, and federal partners to support our healthcare systems, to address the surge, and to save lives with the resources that we have available to us. We have been coordinating the allocation and monitoring of our federally distributed monoclonal antibody therapies, working on expansion of administering those therapies, and identifying staffing resources for sites. We are supplementing mechanical ventilators to meet surge demand in ICUs, and we've requested additional stock from the national stockpile. We're surging local supplies of PPE for healthcare workers using state supplies. And we're identifying federal staffing resources to support our hospitals. The Department of Defense have sent 3 teams working in hospitals across the state. However, if the strain on hospitals increases, we are unsure of any additional federal clinical teams that are available at this time. So we are also asking every person every family in this state to do the same and take action. For families across Michigan, and as the governor mentioned, that means 5 simple things that everyone can do to prevent COVID-19 and reduce the chance of hospitalization. Number 1, get vaccinated or get your booster. We recommend that everyone 5 and up gets vaccinated and everyone 16 and up gets a booster. Getting that initial dose this week puts you one step closer to protection against severe disease. And we all need to play the long game here to beat this virus. So far, the data indicate that people who have had their initial vaccine series plus the booster are more likely to be protected against Omicron. This is important not only for your individual protection, but to reduce the risks to your loved ones and children who cannot be vaccinated and to others whose immune systems are not able to protect them against the virus. And while we see some breakthrough cases, vaccines are doing what they are supposed to do, which is reduce the chance of infection and severe disease or death. With Delta as the more common variant in recent weeks, only about 2.5% of people who are fully vaccinated have been reported as a breakthrough infection. If you are unvaccinated, it is not a matter of if you will get sick, but when. And none of us can predict how sick we will get or if we'll give it to a family member. Plus, not every patient qualifies for therapeutics. From January 15th through December 3rd of this year, people who were unvaccinated or not fully vaccinated represented 85.1% of COVID-19 cases, 88.1% of hospitalizations, and 85.5% of deaths. And I know the governor ran through those numbers, but I think they're really important. Vaccines are free, safe, and effective, and remain our best tool to protect ourselves. Layering strategies with vaccination further reduces the chance of getting sick. So number 2, for now, we strongly recommend that everyone 2 and up wear a mask in indoor, public, and crowded outdoor settings. A few weeks ago, we issued a public health advisory to emphasize the importance of masking, regardless of vaccination status, as an added layer of protection. And for holiday gatherings, immunocompromised people should take all precautions of unvaccinated people, including wearing a well-fitted mask. Given the increased transmissibility of Omicron, this is also a good time to upgrade your mask to something with additional layers like a KN95, or to wear 2 well-fitted face coverings. Number 3, get tested, even before gatherings. If you have symptoms, if you may have been exposed, or before any unmasked gatherings, get tested. You still have time. If you're gathering with family or friends, including multiple households, or people from different regions from the state or country, the safest way to avoid unknowingly spreading COVID-19 is to gather in small groups in well-ventilated spaces, ensuring that everyone has been vaccinated and confirming that everyone recently tested negative. If your household is not yet part of our My Backpack program to send those over-the-counter tests to schools, remember there is no cost testing available statewide, including rapid tests in many locations. Number 4, very importantly, stay home if you are sick with COVID-19 or any symptoms of a respiratory illness. Stay home and away from other people. Find a way to connect with your family or friends over the phone or Zoom instead. I know it's not the same, and we were all looking forward to being in person, but I would highly encourage people to be cautious. If you do test positive, ask a doctor if you do qualify for the therapeutics, and visit the state COVID-19 website to find a monoclonal antibody location near you. We're coordinating the allocation of these monoclonal antibody therapies with a diverse group of providers across the state, and we've developed an outreach strategy for expansion. We may be ready to move on from the pandemic, and this virus, all of us are ready. But right now, it's proving once again just how unrelenting it can be, unless all of us take this seriously and do something to slow the spread. So please, if you're gathering with friends, family, or traveling, be extra vigilant, get vaccinated, get tested, and wear a mask to keep your friends and your family safe. I would now like to introduce Dr. Schmidt, who's joining us from Spectrum. She is a pulmonary critical care specialist.
I'm an intensive care unit physician, and what I see every day is heartbreaking. I see school-age children draped over the body of their parent with tear-streaked cheeks and bloodshot eyes, with their mother asking, "Why my husband?" Their parents asking, "Why my son?" What more could we have done? I wrote the first COVID-19 death certificate for Spectrum Health, and since the beginning of this pandemic, I have never taken care of a patient dying from the vaccine. I have taken care of dozens and dozens who are dead from this virus, nearly all unvaccinated. Healthy people in their 20s and 30s and 40s making their last FaceTime call to their loved ones while they're about to be put onto life support, knowing they have less than a 50-50 chance of survival. This is not a game. This is not about ratings or readership or polls. This is about 800,000 American lives, and this is preventable. The mRNA vaccines are the safest, most effective vaccines that humans have ever created, based on over a decade of basic science research and billions of your tax dollars that brought it to fruition. It is a medical miracle of the modern age. We doctors are vaccinated. Our children are vaccinated. You will have to trust me when you or your relative comes to my intensive care unit and needs to be put on life support. Trust me now. Trust this vaccine. Mask, distance, but above all, vaccinate. Boost. We will only find our way through this if we do this together. I'd like to introduce my colleague from the Helen DeVos Children's Hospital Infectious Disease Program, Dr. Dalia Kuhn.
I wanted to thank Governor Whitmer for having us speak our testimonials today. And here are my comments. Early on in the pandemic, what we were really seeing were a lot of adults getting really sick. The patients that Dr. Schmidt was speaking to. But what we are seeing now is that many children are also getting sick enough to need hospitalization and sometimes requiring maximal life support. In addition to this, children can also develop a post-infectious complication called multi-system inflammatory syndrome, where multiple organ systems can shut down. It can be life-threatening, and it requires sometimes stays in the ICU. With this latest surge in Delta, we are seeing not just more cases, but more hospitalized cases. And time again, I've heard from parents who say, "I just didn't think it could get this bad with my kids." And while the risk of severe infection and death is low in children, let's put that into context. It has now become the number 3 non-accidental cause of death, only behind cancer and heart disease in children. So it is not nothing. It's clear also that while kids don't get severe disease, they can readily transmit it to others. Classmates, parents, grandparents, both vaccinated and unvaccinated, and their siblings who don't have the opportunity to get the vaccine because they are just too young. So think about the next Miss Sports dates or other extracurricular activities that the kids have to stay out of, sleepovers, fun times that all kids are missing out on at the moment, in addition to thinking about the more dire circumstances that are associated with severe COVID infections, missed days of schools, poor test scores. All of these are considerations. Not to mention the isolation that can occur from multiple isolation and quarantines that follow an infection with COVID-19 or exposure to COVID-19, resulting in lots of missed days of school and an increase in the mental health burden on our public health systems. So, the best way to protect each other, the best way to protect our children, and the best way to protect our loved ones is to all get vaccinated, all get boosted. Wash our hands frequently, wear masks, socially distance when we need to. Of all the kids that have been hospitalized with COVID-19 that I've taken care of, none of them have been none of them have had vaccines. So they've all been unvaccinated patients. Children make up a substantial portion of the population. It's clear that children are a key part in making sure that we get past this pandemic. As a physician, I ask you to get your kids vaccinated. Be an ambassador if you've already had your own children vaccinated, and talk about how your kids have reacted to it or not reacted to it. As a physician, I have been vaccinated. I have certainly vaccinated my children, including my recently turned 5-year-old the day after he turned 5. I will do my best to take care of your children when they show up in the hospital, regardless of their vaccination status. Help me help our pediatric community in getting everyone, including your children, vaccinated.
Good morning. I work with Miami Public Schools as a special education administrator. And in part of that role, I am the director of our Huntington Woods Early Childhood Center program for special education preschoolers. All of our educators and the students of our parents agree that it's most important to keep our children healthy and safe. And we agree that the best place for our kids to be educated is at school. But in order for that to happen, it is crucial that everyone who can get a booster gets a booster. Our preschoolers, many of them who are youngest Michiganders in school, are testing positive for COVID-19, and they're showing symptoms, which means they're getting sick, which wasn't the case before. Many of our preschoolers are absent, especially the last couple of months, due to COVID-19. And yes, our little guys are very resilient. However, they are exposing their parents and grandparents to the disease. They're exposing their classmates, our school population, our school staff, and some of them are not vetted where they can really stave off the more severe symptoms of COVID-19, and they are getting even more sick. It is my hope that we all make a commitment to take care of ourselves and one another and keep our schools open by getting a booster. And I am comforted by Governor Whitmer in that she shares in this goal of keeping our school community healthy and our schools safely open. I would like to introduce Alita Kelly, who is a business owner. Thank you.
Good morning. My name is Alita Kelly, and I'm the co-founder of Southeast Market, a grocery store on the southeast side of Grand Rapids. Owning a small business in times like these means making tough decisions like how to navigate operations when one crucial staff or owner is compromised or exposed. My business partner contracted COVID last week, and for a small business with a small but tight-knit team like ours, one person out of the mix has large, heartbreaking implications. We're grateful for the leadership of our governor to advocate for us with all her diligence around vaccinations, as it's one of the best ways we can support our families, communities, and one of our best shots at keeping small businesses open. COVID dollars are coming to our county, but unfortunately for businesses led by people of color like ours, we have yet to see any of these funds. I hope that changes, but in this moment, we are depending on the power of our collective community action to do what is right for everyone. Just as it's clear that having access to healthy foods makes for a healthier community, having access to vaccines, along with the education around their impact, makes for stronger communities and local economies. Last night, I had a dream where my grandmas told me that we needed to reimagine public safety. We have an opportunity now to look at social determinants of health and address their role to inform how we keep our communities safe and healthy. I'm looking forward to continuing this conversation with leaders like our governor on how we can empower small business leaders in our community to stay in business so we can serve the communities we live, work, and learn in. Next, we have Pastor Jerry Bishop.
Thank you. While I'm fortunate to pastor in the 49507 area code, zip code, it's also very unfortunate that the area I pastor in is one of the most vulnerable populations in our world-class community. It's also one of the most unvaccinated segments of our entire community. COVID-19 and all of its variants is truly an equal opportunity antagonizer and killer. It's bipartisan, it's cross-cultural, cross-socioeconomic, it's cross-denominational, it's co-ed, and it cares nothing about age. As we get into arguably one of the most dangerous seasons that we've seen, please protect your families from the eternal loss. Please strongly consider getting vaccinated. Please wear a mask, social distance, and please encourage others that you have significant social influence over to do the same. There's probably not one household here that has not been impacted negatively by COVID-19, including myself. Having buried so many people from this devastating virus since January 2020, it is leaving a remnant of devastation that we've never seen, yet you and I can use our social influence to help turn the corner to save people's lives if simply we would just advocate these simple processes of vaccination, the booster, masks, and social distancing. Thank you. I'd like to turn it back to our governor. God bless you.
Thank you, Pastor. Thank you, Pastor. Thank you, Alita, Southeast Market. Appreciate. Oh, hi. We switched our order. And the doctors. I so appreciate these stories that you've shared with us so that people can understand how serious this moment is and how important these vaccines are. With that, I'd be happy to open it up. I know you're all freezing, so let's jump in. Go ahead, Eric.
Yeah, thank you for doing this on the first day of winter outside.
You're welcome.
We've been seeing reports already out of South Africa and Europe that while transmission rates are up, hospital rates are dropping. Is it safe to say, or is it believed that it's more transmissible but maybe more mild, the Omicron variant compared to others?
I'm gonna ask either the director or one of the doctors to come and give a little more insight, but I'll say this. What we know is that Omicron is moving fast. As you saw the reports nationally, they're saying that 73% of new cases nationally are the Omicron variant. When that many more people can get it, even if it is less deadly, and I don't know that we can conclude that yet, but even if it is, it still means that many more people will end up in a dire situation where they are filling hospital beds that already are full. So I think that while we can take maybe a little solace in some of the initial reports that perhaps it's not as deadly, I don't think any of us can make any assumption in terms of what that could mean for us individually. But Director, anything you want to add? Okay, thank you. Doctors, anything to add? Yeah.
I think one of the things to keep in mind about this virus is that first we see the infections, then we see the hospitalizations, usually about 2 weeks later, then we see the ICU start to fill up, and then we see the mortality. So there's really no way we're going to know what the true effect of this variant is until all that time gets a chance to play out. And with as catchy as it is, it's really just not worth us running the risk with it.
Go ahead. Well, you know, the numbers will rise and fall, and because of the lagging indicators in terms of when you have exposure to when there's hospitalization or ICU or, need for a ventilator, I just don't think that we can take any solace in a somewhat downtrend. I mean, that's good. It's a good development, but I don't think that it is indicative of a trend. We can't make it that assumption. The one thing that we do know is that if you're vaccinated and boosted, you've got a lot more protection against this virus. I know that we're seeing people who are vaccinated and boosted test positive for COVID. I think the goal is, of course, all of our individual goal is not to get it in the first place, but the goal is to stay out of the hospital. The goal is to stay alive. And our odds of doing both of those are much improved if we are vaccinated and boosted. I have come to appreciate the fact that because this virus is mutating and it's spreading so quickly, every one of us is likely going to have some exposure at some point. What is our goal? To stay out of the hospital and to stay alive. And the best way to do that is through vaccination and through being boosted. And also being smart. Upgrading your mask, as Director Hertel mentioned, not having big groups of people that you don't know their status and that you're in close contact and it's not ventilated and you're not masked up. These are the things we know, and these are the tools we have that we didn't have, a year ago. So we're in a much more informed position of how to stay safe, but getting those vaccines is critical. Yeah. At this juncture, we've got tools we didn't have. We've got knowledge we didn't possess at the early days of the virus. We had to use blunt tools in the early days, and we saved thousands of lives doing that. At this juncture, we know that it's the unvaccinated population that is most at risk to themselves, to others, to all of us in terms of being a vector for a mutation, right? And so that's why our focus has to be on making sure that people get boosted and the unvaccinated get vaccinated and that our kids get vaccinated. Sweeping mandates are less likely to influence and encourage that population to get vaccinated. And that's why it's an education effort. It is sharing what the experience is, what the real threat is, how powerful and quick spreading the Omicron variant is, and why it's important that we avail ourselves of these vaccines. Yes. You can go on to Michigan. What's the website? Vaccine.gov?
Vaccine Finder.
Vaccine Finder, thank you. And make your appointment now. And the reason we say days, not weeks, is because we are seeing how quickly Omicron is spreading. My team and I, we're always consulting with our local physicians, with our expertise here in Michigan, but also national experts. We had our calls on Sunday morning. I don't know what you all do Sunday mornings, but I talk to national experts on COVID so that we are making smart decisions. This virus is spreading so much faster than anyone anticipated in terms of this particular mutation, the Omicron variant. And that's why when we say days, it really is moving fast, and we want people to move fast as well. You can stay out of the hospital. You cannot be that story that the doctor shared about children crying because their parents are sick, or children who are being admitted. Get vaccinated, and going to Vaccine Finder is the best way to make your appointment now.
We have time for one last question. Governor, this is the first COVID meeting you held in several months. Why didn't we hold them during this current spike? And is it because we're now closer to election?
Listen, I've done hundreds of briefings since COVID first came to Michigan. Especially in the early days, it was critical because we didn't have a lot of information around COVID and people were scared. We didn't know a lot, but what we did know we wanted to share as quickly as possible. Director Hertel has continued to make sure that she is having regular briefings so that people understand the seriousness of the moment and what is happening. So we will continue to provide information. We will continue to keep the public informed. I think it's important to recognize the vast majority of people in our state have availed themselves of the tools to stay safe. That is a wonderful thing. We have more work to do. Those who have not yet been boosted, now is the time to get there. Those who have not yet been vaccinated, please do. Don't take it from me, take it from all of the people that we've heard from. Our goals are to stay out of the hospital, to keep Michiganders alive, to keep our kids in schools and our businesses open, and that's what today is all about. We'll continue to have briefings, but they will be headed, as usual, by Director Hertel in the Department of Health and Human Services. I hope everyone has a happy holiday, stay safe, and that all of you who've been sitting out here in the cold go and get warm. Thank you.